California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Welcome to California Pediatrics, where we discuss topics of interest and highlight the professional trajectory of our guests. I'm Grant Christman, a pediatric hospitalist in Los Angeles.
And my name is Eric Ball. I'm a primary care pediatrician in Orange County. And I'm pleased today that our guest is Dr. Phyllis Agran, who is also a pediatrician and is the recipient this year of the American Academy of Pediatrics California's Marty Gershman Advocacy Award for her lifetime of excellence in advocating for children at a state level. So thank you for joining us, Dr. Agran.
Well, thank you.
So you are a pediatric gastroenterologist by training. Can you talk to us a little about how you actually got into advocacy?
Well, advocacy goes a long way back. I mean, I was fortunate to have my parents as role models, and as you encounter injustices, you need to take action to try to correct them. And that has carried me forward through high school, through college, and my trajectory in public health and through medical school. So as a pediatrician, we take our clinical experiences, and that builds us our scenarios to advocate for the optimal health and well-being of children.
So were there any specific instances or patients who got you in this trajectory? Especially you have a passion for injury prevention, for drowning prevention. What brought you down that road?
Well, one of my continuity patients who had complex medical needs, had a gastrostomy, a VP shunt, was neurologically impaired, came into continuity clinic, and we were delighted that kid was doing really well, getting appropriate therapies. Mom was coming in for continuity visits, and later that night, I was on call in the emergency room, and that child came in having incurred an injury in a car crash. My attending, Susan Tully, who is also a fellow of the American Academy of Pediatrics and our residency director at UC Irvine, where I was a resident, asked me after the patient was stabilized, did you talk to that patient about, or to the parents, about making sure that kid was in a car seat? That was a lesson learned. The next episode related to drowning was I was in the ICU at Chalk, second-year residence. We didn't have attendings. We were it at night. Ralph Rucker was our attending, and a toddler came in having drowned in the spa of his family's home. And we stabilized that kid overnight. And I thought the next morning, because we were up all night working with the child was in reasonably good shape and seemed to be recovering. And we were expecting to be complimented on the quality of care we provided. So Dr. Rucker didn't do that. He said, did you go out and talk to the parents about a fence around their pool?
Wow.
Wow is right. And he sent us out there to talk to do anticipatory guidance. But you know, this is what we do in pediatrics on all kinds of issues. So those experiences, and also maybe because I had a toddler, got me into injury prevention.
I'm just thinking about early career pediatricians or maybe even residents who might be listening and curious about any tips you might have for having difficult conversations about injury prevention with families, because that sounds like a really difficult thing to do, especially if their child is actually in the hospital for an event that happened.
Actually, it is difficult, and I'm just going to pivot your question.
Sure.
Anticipatory guidance, and we have our Bright Futures guidelines, is really critical. And for injury prevention, we know what the messages are because we look at the leading causes of fatality for children. And you know, in the first year of age, it's SIDS, suffocation. In the 1 to 4-year-olds, it's drowning, and it used to be motor vehicle crashes, but it's not anymore now that we have car seat laws. And you look at the leading causes, and you look at your clinical experience, and you have to decide, where's your passion? Is it with adolescents? Is it with young kids? And then you take your clinical experiences and you translate it into action, and that's what we're made to do. And I just want to share with you, Mark Del Monte, who's CEO of American Academy of Pediatrics nationally, said, we chose pediatrics and advocacy as part of our DNA.
Mm-hmm.
And that's what we do. And there's so many resources for our early career physicians. Latch on to one of us. We're here, we're willing. You've done it, each of you have done advocacy, and we welcome the opportunity to work with you. And it's not something, it's a journey, and it's difficult to get started, but it's fun.
So you've been doing advocacy in California and locally for decades now, and you've been a major part of a lot of laws that have been passed and really saving children's lives all throughout the state and the country. So how did you translate advocating at the bedside to kind of at a bigger picture, so advocating through the legislature or in a state or federal?
Okay, let me share with you the story how we got California's first child passenger safety law passed. I was a resident at the time. My buddy Bob Vanetz, a pediatrician in LA, called me up and said, Governor Brown just appointed the first director of the California Office of Traffic Safety, and he's coming down and speaking at a meeting in Anaheim, and you and I are going to crash that meeting. So I said, really? He said, yes. So Bob and I went down to Anaheim, and I'll just tell you a funny story. We had never met Tom Lankard, who subsequently became a good friend until he recently passed. And in walks a tall, thin male with motorcycle garb and carrying a heavy helmet. And I guess my mouth was opened, or my eyes, I was staring. Bob jabs me, and he said, we're not here to talk about motorcycles. We're here to talk about child passenger safety. So I said, okay. So we actually had a great conversation with Tom Lankard, and he awarded us our first grant, which was, the hypothesis was that if a child's in a car seat in a car crash, that child would be less severely injured versus an unrestrained child. You're laughing. You probably were brought up in car seats. Okay, yeah. I wasn't.
Right.
Okay, so we took that data and published it. And then my husband was a former legal counsel to the state Senate Health Committee when Reagan was governor. So he had the experience of crafting laws. We didn't have legislative counsel then. He found a legislator, Assembly Member Mel Levine in LA, and they wrote California's first child passenger safety law. So I went up to Sacramento along with Bob Vanetz, and we got other stakeholders, parents and advocates, for child passenger safety. And I provided the expert testimony at the Transportation Committee meetings. And it was very compelling. I mean, they couldn't say no. You're talking about kids. We are unique, and I'm just going to pivot for a sec, as pediatricians, because our constituents are the children, not us. Yeah. So when I finished the testimony and everyone else spoke, the chair of the committee said, we're going to vote for this because parents aren't smart enough to put their kids in car seats. But don't you come back next year and ask for a seatbelt law for adults. So next year, we have mandatory seatbelt laws, and you all grew up in car seats.
Totally.
Yeah.
And I'll tell you this, and AAP National, AAP California, and our locals have done a tremendous job to the point where there's been a 75% reduction in child fatality since 1975 across the country because of better car seats, improved roads, better vehicles. And that's a remarkable statistic. And that's kind of our model for moving forward.
That's an amazing change over a medium to long period of time. That's pretty amazing.
And do you have some experience with car seats related to your family that you were discussing?
Yeah, I mean, we were talking about how my grandfather was one of the earlier manufacturers of child-safe car seats. And that was definitely something that inspired me actually to go into pediatrics because, I mean, from a very early age, I got the message from my family that protecting children was important.
And you've done that. And the very first car seats in the 50s, and actually one of my interns, I said, I need to find one, and he found one on eBay, was a seat that was not designed for safety. You'd hook it over the back of the front seat, and it had a little steering wheel, and the kid could see out of the car. And in the case of a crash, the car seat was ejected, and of course the steering wheel promoted chest injury. So we have come so far with safe car seats, and it's the law. And we've gradually improved the law in California, and California has one of the best laws in the country, yet there's room for improvement.
Actually, because you also brought up drowning, and I think that that's an area that's still a major threat to young children. I know that we have some laws to prevent childhood drowning, but I was wondering if you might want to talk about, like, what's the frontier of advocacy in drowning prevention?
Sure. I think all of us as pediatricians are aware that drowning is the leading cause of death among children 1 to 4 years of age in the United States and in California. We've had a pool safety law on the books in California since 1996, and we have not seen a significant decrease in fatality from drowning among that age group. So as my physician friend, who's also a biomedical engineer, says, we have a system here in California that's designed to do exactly what it does, produce 50 child fatalities a year among 1 to 4 year olds from drowning. So there's a huge amount of work to be done. And again, I'm going to come back to pediatricians are unique. And when we're out there talking about children, people listen. We're not advocating for products. We're not advocating for taxes. We're advocating for children. And just sort of as an aside to the drowning, over the years, we've learned that we need to address the social drivers of health, as we now call it. This isn't a new concept. This goes back to the 1800s, but it was called social medicine. So if a kid comes in and doesn't have enough food or formula, doesn't have transportation, doesn't have secure housing, how do we treat the kid if we don't address those issues? So I'll flip back to drowning now. We have so much more to do. It's preventable. And the major issues relate to pool fencing and to use of U.S. Coast Guard approved life jackets instead of, you know what those floaties are? Were any of you in floaties?
I was. I think my kids were as well.
Tell me the story.
I was in floaties as a kid, and I believe I put my own children in floaties. So what's wrong with floaties? What's the better option for families?
Well, floaties are toys. They're aquatic toys. They're regulated by the Consumer Product Safety Commission. So I don't know if this ever happened to you or your kids, or you watch at your pool. Floaties float off.
Yeah.
They deflate, and parents are under the perception that they're swim aids and they're protective. In fact, they are not. Last year, a bill was chaptered into law on personal flotation devices. It says, as of January 2026, any personal flotation devices for infants and children must be U.S. Coast Guard approved. So no devices which are not U.S. Coast Guard approved can be manufactured, sold, or distributed in the state of California.
So as a pediatrician, what do I tell my patients to use as a flotation device for safety for their children, or do they need that at all?
U.S. Coast Guard approved life jackets should be used in and around any body of water by young children and unskilled swimmers. So that means if you have a pool, or you go to your community pool, or you go to a public pool, or you go to the ocean, put your young kids in U.S. Coast Guard approved life jackets. Life jackets are life-saving. And the statement about use them for young children and unskilled swimmers as part of our AAP policy, prevention of drowning. So what we're going to do in Irvine is launch a Buy Back Your Floaties program. The city of Irvine has ordered life jackets, and they're having a series of events. And we're going to hopefully have parents turn in their floaties, and we're going to fit the kids with the U.S. Coast Guard approved life jacket. Our other partner is the Orange County Fire Authority, and they have a wonderful video that you'll have to watch to fit the kids in life jackets. And we're going to weigh them, and we're going to show the parents how to put their kids in life jackets and explain to them what the main interventions are to prevent drowning.
That's
So you can sell her
fantastic.
your floaties.
Like, take them out. I would trade them in. That's fantastic.
Trade in your floaties. And you know what? If you don't have them anymore, we'll give you a life jacket.
I love it.
I actually have a related question because I have had patients and families, but also friends mention that their toddler to preschool age children had swimming lessons, so they no longer need a fence around their pool. And I was curious to hear your thoughts on swimming lessons for young children, which I think is different from what you mentioned about older children and adults who are very well trained, may not need life jackets. But how should parents look at their very small children who have had swimming lessons, even if they've performed pretty well during those swimming
I'm
lessons?
glad you asked, okay? So swimming lessons are great. Swimming's fun. It's great family recreation. It's good exercise, and we promote it. But are you going to trust a toddler who may be able to, who has the motor skills to swim, to have the cognitive skills not to swim down to the deep end, or
Right.
not to jump in, or not to jump in with a toy? If I had a backyard pool and I said I don't need a fence because my kid had swim lessons, I would hope my pediatrician would say, "Are you kidding me?" You know,
Yeah.
if a child walks out at night, and this happens, sees something in the pool, decides to jump into the pool, you don't know it.
Yeah,
And what's really critical is submersion time.
right,
Okay, if say the kid falls in with his or her their clothes on,
right.
do you think they have the skills to get to the side of the pool? So yes, swim lessons are important. It's not a substitute for supervision, and it doesn't mean you can remove your fence if you had one. So we advocate swim
I
lessons.
thought you might say that.
Yeah, but it's a layer of protection, and it's not a substitute for supervision.
Yeah.
So put on those life jackets. It'll buy you time. Just to backtrack for a sec, pool fencing will prevent unauthorized access of toddlers to pools when they're not supposed to be there. It's like put the pool in jail, okay? Make your backyard safe. And then the second thing is when the kids are swimming with you, you know, people out there are more than happy to blame parents, to blame us and to blame parents. You didn't watch your kid.
Yeah.
You all know, because many of you have children, and many of you, and we take care of children, you can't supervise 24/7. So part of supervision, I think we have to change the norm. If you choose to have a home with a pool, part of supervision is fencing that pool.
Mm-hmm.
We don't have a state law that requires fencing, which is the only research evidence-based best practice, and it's an option. So our advocacy is for pool fencing, and we need to make some progress on that. And then the second thing, when you're at the pool with your kids and you have more than one kid, how do you watch them when one's running one way and the other's doing something else? How are you going to watch them?
So why have we made progress in car safety but not in pool safety? And what do you recommend that we advocate for?
Okay. Well, first, on the pool fencing, last year in San Jose at a residential child care facility, 2 toddlers died and 1 survived. The community, and these are where our parents are so useful as advocates, talked to Assembly Member Gail Pellerin from San Jose, And she submitted a bill last year that requires, and that bill is now chaptered into law, that requires daycare facilities, and a home child care is a daycare facility, to have a pool fence and a pool cover or a pool alarm, that the owner has to inspect it daily, and there has to be rescue equipment. So we're now saying home child care is at a higher standard than my home as a parent if I had a pool. So I think here's our wedge for moving toward educating our policymakers. We need mandatory pool fencing, but we also need multiple layers.
Right.
And related to that, in my own city, Irvine, a dad almost lost his kid in a backyard pool. And he, in the 1990s, started advocating for Newport Beach and Irvine to pass a pool safety law. So I was out there working on that. And advocacy needs to be fun, but you got to take hits. You have to have a thick skin. And if you don't succeed, go back again. So we were encouraging the city to pass a fencing ordinance. And one morning, the Orange County Register published an editorial called Irvine Belly Flops. And they basically targeted my husband and said it's not enough that former mayor Larry Agran is a nuisance, but his wife is out there getting kids harnessed in car seats, and now she wants us to put fences around pools. And basically
nuisance.
referred to as a safety fascist. So at first I was
goodness.
mortified, because I hadn't been targeted like that. And then I thought about it, talked to my husband, and I said, I guess that's means we're having an impact.
Badge of honor.
Yeah. It's being noticed.
Right. And so we do have a pool fencing ordinance. One of the layers of protection in the city is a fence. So we need to move that way. Are we going to get there next year or the following year? Probably not, but this is a long, long fight.
I think culture can change. I mean, you brought up earlier how the culture around adults wearing seatbelts changed, because I remember being a young child and seatbelts being mandated for adults, and many adults being very upset that they were being told that they had to wear a seatbelt by law, but now nobody really questions that, at least not that I know.
So it's really changing the norms. And, this Marty Gershwin Award that you mentioned, he did so much advocacy, and I was looking at the purpose of the award. It was educating policymakers. We educate our patients and our families. We need to educate our communities, and we need to educate the policymakers, and that's why we have our AAP California Advocacy Conference, and it's training the next generation. I don't have 40 years more to get pool fencing, but I'm going to rely on the younger generation or the newer pediatricians to be out there. And this is a low-hanging fruit.
So with that, I think as we come to a close, there's a lot of pediatricians out there, me included, who have very similar stories. I think seeing children die of drowning is something that many pediatricians have dealt with, and it's heartbreaking. And we see a lot of other terrible things that probably were preventable. So for those people listening to this, what's your advice of, if you have that, if you're seeing these patients, what's the first step that you can take towards advocacy?
The first thing is to appropriately inform your families and educate them and encourage them to educate others. So that's our first step. Then, what's going on in your community? How can you participate in the community? Can you approach your local elected officials, your city council members? Can you write op-ed articles? Can you write something for your newsletters in your community? Can you talk to your PTA? Can you go to the schools? There's so many opportunities. And then gradually, as you have successes, or even if you don't, you keep fighting and you move up from the community to the state legislature, from the local to the state. And just sort of to bring this to closure, things are difficult now with what's going on at the federal level. And many pediatricians say, what am I going to do? You got to stand up, step up, and speak up. and now more than ever as advocates. Find your passion, find your issue, and we're here to help. We're here to mentor. I was mentored. I continue to be mentored. I learned from the younger generation. You know, you're very adept at social media. I'm not. So if we work together and team up and find somebody that you can team up with, because it's more fun and more successful.
That's great. That's a great message. I think it's a great note to end on. Thanks so much, Phyllis, for joining us.
Thank you.
And thanks for all you do for kids in
So
California.
no more floaties. Bye-bye floaties.
No more floaties.
Thanks, Phyllis.
Thank you.
So, Eric, I really appreciated in that conversation hearing from Phyllis about how young pediatricians can get involved in advocacy based on things that they're encountering, and whether that's in their residency training or in their jobs in the practice or in the hospital, that our patient encounters are really what inspire us to become advocates and take action.
I think every day we see things in our clinic or in the hospital that we wish would change, or patients that we really wish we can help on a wider level. And it was really interesting to see how Phyllis took those and went to the legislator, went to her local city, and was able to make changes, especially around injury prevention and swimming prevention and drowning prevention.
Yeah, and I think I also really appreciate that, while, preventing something like drowning can sometimes feel overwhelming, that there are really some very concrete things that parents can do to establish layers of protection around their children, like using a proof life vest, making sure that they're only going to parties or visiting people who have appropriate fencing around their pools.
Yeah, I mean, it was a real honor and privilege to be able to talk to Dr. Agran, who's the recipient this year of the Marty Gershman Advocacy Award for all of her work in this. I mean, she has saved countless lives in California through her advocacy, and something that I think all of us pediatricians, and especially young pediatricians, can really look up to. And so with that, I'm really happy that we were able to have this conversation today, and this was an awesome episode of California Pediatrics, and we look forward to having more good conversations with pediatricians in the future on future episodes.
Thank you for joining.
And we'll see you next time.